And this is big news. The CDC gave the green light to the Pfizer vaccine for children 5 to 11 years old. Pfizer already started packing and shipping the first orders, millions of doses worth, to states and pharmacies to be ready for this big announcement. While most kids don't get nearly as sick from COVID, as adults, a vaccine offers a lot of protection and benefits, like fewer missed days of school, as well as a decline in hospitalizations. The now approved kids' COVID vaccine was the main topic of conversation at today's briefing from the Idaho Department of Health and Welfare. That's mainly because, as we've seen over the past 18 months, the pandemic caseload ebbs and flows over time. Our Brenda Rodriguez listened in on the meeting today. And Brenda, what did the state have to say about vaccines for kids?
Yeah, so state health officials were very optimistic about the arrival of the COVID-19 vaccine for those 5 to 11. They say while this could help alleviate some of the stress on our state health care system, they are still encouraging all Idahoans to get vaccinated as soon as you can.
Right now, roughly 7% of the COVID-19 cases reported each week during October were among children between the ages of 5 and 11.
Deputy State Epidemiologist Dr. Catherine Turner says cases have decreased in the last 2 weeks. And although things are starting to look better, Turner says there is always a better opportunity to provide extra protection to children and adolescents.
This is a significant step forward in our ability to prevent COVID-19 illness in children.
The kids' vaccine will be lower doses and will be administered at least 21 days apart. Idaho Immunization Program Manager Sarah Lead says appointments will be available later this week or next week at the latest. And at this time, 23,400 doses have been shipped by the manufacturer to Idaho providers and public health districts. Large pharmacies did not receive the first round of shipment, but should be receiving them later this week. Lead says all of Idaho pediatrics will receive doses no later than November 8th. And St. Luke's pediatrician Dr. Lisa Barker says many parents have questions regarding the vaccine.
Most commonly, I'm asked about the risk of myocarditis, which is inflammation of heart muscle. There have been rare cases observed in primarily older adolescents and young adults, and more commonly in the male gender.
Barker says these cases have been mild and self-resolving. However, she says they will be monitoring this closely. Barker also says that there is no evidence of long-term effects of vaccines similar to the adult data. Another topic discussed in the meeting were booster shots. Health officials say that there's been an increase of Idaho residents getting one. As of Tuesday, 118,392 boosters or additional doses have been administered. IDHW Director Dave Jepson also says the number of COVID-19 cases are declining, but still too high for hospital resources.
We'll still rely on the hospitals for their input. Again, we're in contact with them literally every day with what the situation is for each of them. And when we think we're getting close to that point, we'll convene the Crisis Standards of Care Activation Advisory Committee.
Now, at this time, Jepson says it's unknown when crisis standards of care will be lifted in Idaho, and we'll have more information on where you or your child can receive a vaccine or a booster on our website at ktvb.com.
Yeah, a very fluid story, of course. People can always stay up to date here on KTVB. Brenda, thank you.